Hello there. You are listening to Chapter 22, Infection Prevention and Control in Learning Plan number 3. Infection. Infection is defined as when microorganisms are capable of producing a disease that invades the body. Healthcare-related information is an infection that is acquired as a result of a healthcare person. This can be a cost to the healthcare system itself. It is a leading cause of death. So someone comes in with one thing, but they end up with another. One of the big ones is urinary tract infections, and that because of a Foley being placed, either incorrectly or not by sterile technique. It is preventable with the use of aseptic principles and techniques. You will also learn one of your skills is aseptic technique, which is my favorite. The spread of infection. What it is, there are 6 links. The first link, or one of the links, is an infection agent. You need the pathogen. And it's also normal flora that can become pathogenic. A reserve or reservoir. This is where the pathogens live and multiply. They may be living. This could be on a human, an animal, or an insect. It can also be non-living, such as food, on the floors, our equipment, any contaminated water. Portal of exit. This can be done via our body fluids, when we cough or sneeze or have diarrhea, any wounds that are seeping, as well as any tubes or IV lines that a person has. What are some modes of transmission? And we will talk about these a little further in the presentation. There is contact transmission, which is direct, is by touching someone, kissing them, any sexual contact. Indirect can be contact with a fomite. Droplet. Droplet transmission is done when a person coughs or sneezes. It goes in the air. Or there's airborne. That's via an air conditioner or when you actually sweep a floor. That can also be a mode of transmission. Portal of entry. It can come into your body or a person's body through their eyes, their nares or nose, mouth, vagina, cuts, or any scrapes that a person has, even a little scrape. It can be entered through a wound, a surgical site, an IV or a draining tube site, any bite from a vector. Who is a susceptible host? That can be a person with an inadequate defense, someone who has low white blood counts, someone who's very ill. Those are inadequate defenses. 4 determining factors: the virulence of the person or the disease, the organism's ability to survive in the host's environment. A lot of times they like warm and dark. The number of organisms that are present, and then the host's defenses. And again, what's their white blood count look like? Overall general health, how are they? There are several classifications of infection. There is a local infection that can cause harm in just a limited body area. You get a sliver. It's just localized and it's only red to that particular area. Systemic, that's where the pathogen invades the blood or lymph nodes and spreads throughout the body. Typically, if they have a fever, now it has gone systematically. Instead of just being to the local site where it's just warm to touch, now you're running a fever. That's systematic. Primary, first infection in a patient. Secondary, subsequent infections in a patient. Exogenous healthcare-related infection, that's a pathogen acquired from the healthcare environment. That could be by us not cleaning correctly or not cleaning at all. Or endogenous healthcare-related infection. That's normal flora multiply and cause infections as a result of treatment. Acute, that is a very rapid onset and it's very short lasting. It's just an acute phase. Chronic, it develops very slow and it can last for weeks, months, or years. That's a chronic infection. And then a latent classification is where it causes no symptoms for long periods of time. The stages of infection. There is the incubation stage. This is from the time of the infection until it manifests into symptoms. It can also affect others in this time frame. Prodromal, that is the appearance of vague symptoms, but it is not all diseases have this stage. Totally will skip this stage. Illness, that's where the signs and symptoms are present. Decline, that means that the number of pathogens are starting to decline and your patient will start feeling a little bit better. And then there's the convalescent stage. This is where tissue is starting to repair and the person is starting to return to their health prior to the infection. Question. A client living with AIDS develops oral hairy leukoplakia. That is an infection caused by the Epstein-Barr virus. The leukoplakia is considered a nosocomial infection, B, primary infection, C, systematic infection, or D, secondary infection. So what is leukoplakia considered? The correct answer is D. The primary infection with the HIV virus causes the client to become immunocompromised. Thus, that causes the development of that secondary infection, the leukoplakia. Some emerging pathogens, and you'll hear these, you hear them in the news, you hear them in history. They talk about these emerging pathogens. There's an epidemic. That is an outbreak that affects a large group of people in a geographical region. That could be a state or a city. You have a pandemic, which currently you hear of the SARS. You also hear right now of the COVID-19 pandemic. That is exceptionally widespread epidemic, meaning worldwide. It's a pandemic. Emerging diseases, those are brand new infections that are coming out. What are some lines of defenses against infection? The primary defenses, that is our anatomical features. It helps limit the pathogen entry. Our normal body flora, intact skin, our respiratory tree, our eyes, our mouth, normal flora in the GI tract, and there's also normal flora in the urinary tract and the anus. All of these are our primary defenses as long as they're a healthy individual. Our secondary defenses, this is the biochemical processes that are activated by chemicals released by pathogens. There's phagocytosis, complement cascade, inflammation, fever. Those help naturally stop an infection before we start giving them medicine. It's what's the natural response. And then there's tertiary defenses. This is our humoral immunity. That is the production of antibodies in response to the pathogens. And then you have the cell-mediated immunity, and that's the direct destruction of infected cells by the T cells. These you should have learned or heard about in, or will be hearing about in your anatomy and physiology classes or microbiology. Factors that increase the host susceptibility. The developmental stage of the person, if they have any breaks in the skin, so it's good to always, cover them up or be cautious. Any illness, injury, or chronic disease that the person has. Tobacco use and substance abuse. Smoking, drinking, those all have a factor. Multiple sex partners, any environmental factors, chronic diseases, any medications that inhibit or decrease the immune response, chemotherapy drugs, or any nursing or medical procedures that can also increase susceptibility. An assessment on infection. So when you're looking at someone and when you're going to do your assessments, you're going to gather the nursing history. What medical history do they have? Do they have a family history? What is truly going on with them? Some of the statements that you'll take from them, or questions that as part of the communication you're going to be asking them. What's the nursing history that you have? And then your actual physical assessment. Lymph nodes. Are they running a temp? Check their vitals. Check their skin. Do they have any skin breakdown? What is a physical assessment that you're doing on them to see if they have an infection brewing or are at risk for an infection? And then an analysis or nursing diagnosis in infection, since we, part of the nursing process is coming up with a nursing diagnosis. The only diagnosis out there is risk for infection. There's not an actual one that says infection, but everyone, or virtually everyone who comes into a healthcare setting are at risk for infections. And then some of our planning outcomes or evaluations in regard to infections. There's just some standard outcomes. What do you want to do with them? And then always remember, though, use those individual goals and outcomes, and that's dependent on that nursing diagnosis and the etiology. Why do they have an infection? What's going on? So always make sure that it's individualized as well. Don't make it a standardized goal. And then what are some planning interventions? We're going to teach them about infection protection, proper hand washing. It always seems to be a big one. And then always promote wellness and support those host defenses. Make sure they get enough rest, eat adequately, get some exercise, hydrate. Those are all promoting wellness for our patients. Factors that support those host defenses, again, nutrition. It helps manufacture cells of the immune system. Eat a good, well-balanced, healthy diet. Hygiene. Hygiene is good. It's sufficient to decrease that skin bacterial count. Not overzealous, causes skin cracking. So it's not like every 5 minutes I have to wash my hands. If you work in healthcare now as a CNA or any other form of healthcare, you wash your hands quite a bit. And if you do like I do, my hands get very dry. So I like to put lotion on to keep my skin from cracking because I don't want any open sores. We can support that, and we can also educate our patients on the same thing, but good hygiene. Take showers, wash your hands. Rest and sleep. If you can, encourage them to get at least 8 hours of sleep. Everybody's a little different on their sleep pattern, but make sure they have adequate rest and sleep. Exercise and activity. Get up moving. Don't be just sitting on the couch or sitting in a chair. Get up and move a couple times during the day. Get some activity going. Stress reduction. You cannot eliminate stress, but find ways to help reduce some stress. Sometimes that might be just going for a walk, reading a book, meditating, yoga, whatever it is. And then keep the immunizations up to date. Make sure that you've got your immunizations accurate. Preventing infections. How do we practice medical asepsis? There is a difference between medical and surgical. Medical asepsis, the definition is a state of cleanliness that decreases the potential for the spread of infections. This is promoted through maintaining a clean environment, clean hands, following the CDC or the Centers for Disease Control and Prevention guidelines, creating a protective environment in some situations, especially those that are going through chemotherapy, and then controlling our contaminated supplies. Hand washing. We'll talk about this a little further, but how long does it take to wash your hands, or what is appropriate? Water, prefer warm water if at all possible. Soap, make sure it's approved soap at the facilities. Friction, make sure you rub all surfaces of your hands, even under your fingernails, in between your hands. And then drying, make sure your hands are well dried. You should wash your hands when you arrive on the unit, when you leave the unit. That also means before and after going in a resident or a patient's room, before and after restroom use, before and after any client contact, before and after contact with the client's belongings, before you put gloves on, and then once you take your gloves off, even for a short amount of time and you're going to re-glove, you still need to wash your hands, before and after touching your face, before and after eating, anytime you touch a contaminated article, no matter what it is, and if you see visible dirt on your hands, wash your hands. Some of the guidelines that we follow for washing hands, this was also taught in the CNA course. You need to wash for at least 15 seconds in a non-surgical setting, so meaning when you go into just a regular patient's room or in a healthcare setting that's not surgical, you want to wash for a minimum of 15 seconds, longer if they're visibly soiled. And then 2 to 6 minutes in any surgical setting, and that's the surgical asepsis. You want to remove jewelry and clean beneath your fingernails. Always use a bactericidal solution or use water if hands are visibly soiled. So always try to make sure you use warm water, not hot. Apply soap to wet hands. Again, use that friction. Make sure you rinse the soap and then towel or hand dry, doesn't matter, either one. And then sometimes what they do also is they suggest and recommend scrub soiled hands with a cleansing brush or a sponge. That'll help get some of those in between those little crevices. How do we maintain a clean environment? Well, we clean. And that can be on any visible soil, on objects and surfaces, making sure there's no dust. But that's cleaning. Disinfecting, that's where we're going to use some kind of chemical agent, and that will remove pathogens on any inanimate objects. And then the third one is sterilization. This is where we eliminate microorganisms except for prions, and that can be in or on any object. And usually with sterilization, they go in what's called an autoclave. Question: which action violates a principle that is key to proper hand washing at the bedside? A, washing your hands for 1 minute. B, shaking your hands dry over the sink. C, using warm, not very hot water. Or D, using the soap provided by the agency. So which violates a key principle? The correct answer is shaking your hands. That will not completely remove the excess moisture. What it does is it helps reacquisition, of the bacteria on an area. So all you're doing is spreading what you just washed. Implementing CDC guidelines, standard precautions. Standard precautions are, and that's hand washing. It protects the healthcare worker from exposure. It'll decrease those transmissions of any pathogens. And it also protects the client from pathogens that are carried by us, the healthcare workers. Contact precautions. This is transmission based. Contact precautions is a pathogen that's spread by direct contact. Sources can be a draining wound, any secretions, supplies, those all can be spread by contact. Precautions include possibly giving them a private room if we're able to. Make sure you have clean gown and glove use. Dispose of those contaminated items in the room, and typically they have bins placed right inside the room or just outside the door of the room in a bag or a container. And then you also want to double bag the linen and mark them of an infectious source. Droplet precautions. This is pathogens that are spread via moist droplets. This can be done by either coughing, sneezing, or touching a contaminated object. Precautions include, they're the exact same for those for contact, so gown and gloves. But now you want to add the addition of mask and eye protection if you're within 3 feet of the client. Airborne precautions. These are pathogens that are spread via air currents. This is transmitted via a ventilation system, shaking sheets, sweeping again. Precautions that we want to take, again, same as those for contacts, gown, gloves. With the addition, now they're going to be placed in a special room. They're going to wear a special mask, or we are, excuse me, and a mask for the patient if they're transported outside of the room to, let's say, X-ray, or they're going to another department in the hospital. We have to make sure they have a special mask on as well. Question. The client has a draining abdominal wound that has become infected. In caring for the client, the nurse will implement A, contact precautions, B, droplet precautions, C, no precautions, or D, airborne precautions. So a draining wound, which will we implement? Correct answer is A, contact. They are used when you are coming in contact with an infected drainage because that can lead to the transmission of the infection. So again, wash hands before you put gloves on. Once you take those gloves off, wash your hands again. Protective isolation. This is a special isolation. You want to be protective of the environment. So this is where you're protecting those clients from organisms. They're used in special situations with the immune compromised client population. One of the big ones, chemotherapy. Their white blood cell counts are really low to where they cannot fight any type of infection. Because the goal is, especially if they're on chemo or they have cancer, they want to try to kill the bad cells, and by doing so, they compromise and they lower their capabilities to fight off any little infection. Precautions that'll include for those is a room with a special ventilation and air filters, no carpeting, daily wet dusting, excuse me. You don't want to be sweeping. You want to avoid any standing water in the room, such as the humidifier. The nurse is not assigned to other clients with an active infection because, again, they're immunocompromised, so we have to be very careful. We want to use standard and transmission-based precautions, plus mask and other personal protective equipment so that we can protect that patient. Implementing surgical asepsis. That includes you're going to create a sterile environment. You're going to use sterile equipment and supplies. You're going to have a sterilization of reusable supplies. So that just means some of our metal like forceps or basins, they will be rewrapped in a special wrapping again, and then they will go to a sterilization or an autoclave machine and be sterilized again. Surgical hand scrub, again, that 2 to 6 minutes. Surgical attire, sterile gloves, sterile field, and you're going to use sterile technique. Again, this is one of the skills that you're going to use, and you'll use sterile technique in a lot of your skills sessions, as well as out to clinicals. Sterile technique. You always prepare and maintain a sterile field. So Always make sure, don't take your eyes off of it. There's 9 principles you're going to learn. Add those supplies to a sterile field. And then you're going to add sterile solutions to the sterile field. You may have to add various solutions to that. That could be water, that could be betadine. There's a variety of solutions out there that we might have to use. That is the end of the PowerPoint for lesson plan 2 on infection. Excuse me, lesson plan 3 on infection and asepsis. If you have any questions, please let me know.